Hello, how are you? It is I, Ladrissa Bonneville, and I am here at ProFit Studio, and we're ready for ProFit Talks. Today, I have one of my clients, Dr. Johnson, Dr. Karen Johnson. We love her, OBGYN. How are you, Dr. Johnson?
Well, it's a great day for me.
Why is it a great day for you,
I,
Soror?
I had some wonderful news. I have on my Chuck Taylors, I have on my 20 Pearls, Biden Harris all day, all day,
All day, all day.
all day, all day.
I absolutely love it. I'm right there with you. I don't have on my chucks, but I got my pearls on. So it is a wonderful experience to um, be here today of all days. And now I get to spend it with you. So
Yep.
we're going to segue right into it. Karen, like I said before, is OBGYN, and I am going to relinquish the floor to her. And our topics today will be fibroids, menopause, hot flashes, and sexual dysfunction, which I am not suffering from, but Karen's going to tell us how to avoid it. Go, Karen. How are you? Go for it, babe.
I'm great. I'm doing great. So, lots of us do suffer from fibroids. Women of color, Black women specifically, have a higher incidence of having fibroids. Some of the symptoms that you can have is abdominal pain, you can have bleeding. If I put 100 women in a room and did an ultrasound on all of them, Black women, in a room and did an ultrasound on all of them, probably 80% of them would have fibroids. Of that 80% that have fibroids, probably roughly about 50-55% would know they have fibroids. So fibroids are so common, but you don't always know that you have them. But if you do have symptoms, there are some options. Oftentimes, when you go to the doctor and tell them you have fibroids, the first thing the doctor wants to say is you should get hysterectomy. Well, that's the wrong answer. There are lots of options. There's medical treatment, birth control pills. In other words, if you're having just bleeding and the bleeding's driving you crazy, but you're not really having any pain, perhaps birth control pills or tranexamic acid can help you with your bleeding. And birth control pills is every day. Tranexamic acid is just when you're having your cycle. Let's say you're suffering more from pain, but not so much bleeding. Then some of the options are something called a uterine fiber embolization. When they cut the blood supply off to the uterus and the uterus shrinks, that's about 80%, roughly 80% effective. There's also something called ACESA, which is thermal, which is thermal ablation. It's a laparoscopic procedure. They make a very small incision in your belly button. They go in and they ablate, if you will, the fibroids. It's an outpatient procedure. Also, there's something called a myomectomy. Let's say you have fibroids and you want to still have children. One of the only options for you may be to do something called a myomectomy. That's when they actually remove the fibroids from the uterus and then close the uterus back up. And my last choice always is a hysterectomy. So when patients come in and they talk to me, they're having symptoms, they have fibroids, I confirm this with the ultrasound. I give them options, but my first option is always do nothing. But I want to be fair to them too, because I'm not suffering from the symptoms. So do nothing is not an option, then I go through the options, but do nothing is always an option. So if tasked with going to your physician and you're having symptoms, make sure that you understand all of your options.
Okay, I have a simple question. Exactly what is a fibroid and how do they grow?
A fibroid is a smooth muscle tumor. We don't actually know, there's no medical literature that you can read that says why we have them, but we do know that Black women have them more often, so perhaps our muscle tissue is different. So it's a smooth muscle tumor, benign, meaning not cancerous. And why do they grow and how they grow? There is some pretty decent literature that associates fibroids with being overweight. And anecdotally, I have lots of patients who've lost weight and their fibroids shrink. So I think diet, lifestyle, and weight have something to do with the fibroids. And they grow over time. And lots of times you may get your fibroids removed and 60% of the time they come back in 3 years. So how do they grow? Some people say if you take estrogen or progesterone or birth control pills, it makes your fibroids grow. That's not necessarily true, but they are attached to the blood flow that you have in your uterus.
Interesting. Okay. So is there any validity to um, the wives' tale that sugar and yeast feeds the fibroids? Is there any truth to that?
I think that's an urban legend in general. However, as I said, women who are overweight have a higher incidence of having fibroids, and anecdotally, some of the patients that I have that I've seen for years have lost weight and their fibroids shrink with it.
Interesting. That sounds awesome. Okay. So when you talked about the procedure that went through the belly button, could you pronounce that again? What's
Yeah,
that
that's
called?
Acessa, ACE, S is in Sam, S is in Sam, Acessa. It's a relatively new, it is a procedure that I do. It's relatively new, but safe.
Got you. Is there what's the downtime on that?
We usually give about 2 weeks off work because you do make an incision in the belly button and then another incision in sort of the bikini line. You go in with a laparoscopy, which is a camera that can visualize, as well as an ultrasound. So you put the ultrasound up to the uterus, you identify the fibroids, and then you take the thermal ablation and put it actually, oh, please. And then you take the thermal ablation and you put it actually inside the fibroids to ablate the fibroid.
Got you. And so do you suck it out or is it passed through the vagina as in a cycle or is it what, how do you get rid of the ablation portion?
So it's ablated, meaning it's burned and then it disintegrates over time. So it's not going
Oh,
to
it's
disappear. So this is not for fibroids to be removed. It's for fibroids to shrink. So it's similar to, in that way, the shrinkage and to the uterine artery embolizations. The fibroids shrink over
got you.
time.
Okay. And which, if a person comes in and they're suffering and they want something to be done, but do not want to have a hysterectomy, which procedure do you lean towards, or is it case by case?
It generally speaking is case by case. The myomectomy is major surgery, so you have to make an incision in the hairline. You have to remove the uterus from the abdomen. You have to take out the fibroids. You have to sew the uterus up and put it back in. You have to be in the hospital 1 to 3 days. Average is about 2, and the recovery is 6 weeks. So the Acessa and the uterine artery embolization are less downtime. The Acessa is outpatient surgery. The recovery is about 2 weeks. The uterine artery embolization is outpatient surgery, and the downtime is about 2 weeks.
Got you. Awesome information. Thank you for that. Um, wow, it's a lot to take in. So we're going to just switch gears and go right into um, a question every single woman will have in her lifetime is, am I in menopause? And I laugh because, I have my hot flashes. I'm 46. Dr. Johnson, am I in menopause?
Okay, that's the question of the hour. Am I in menopause? So what does it actually mean? So at 46 years old and having hot flashes, you're in something called PERI menopause. So you can be premenopausal, that's before you're having any symptoms, and that's usually before 40 years old. Anything after 40 years old is considered perimenopause. And the range of menopause is 45 to 55. So a patient might come and she might say, I haven't had a period in a whole year. That means she's postmenopausal. So menopause is a syndrome. It's composed of premenopause, perimenopause, and postmenopause. So really, honestly, when you haven't had your cycle for a whole year, that's postmenopause. But in the meantime, you can have all these symptoms. You can skip cycles. You can have closer periods, 2 weeks together, 2 weeks apart versus 21 days. You can have hot flashes, vaginal dryness. I've had several patients that come in and they literally have been to 4 or 5 doctors, and the doctors are telling them that they're going crazy because they're having heart palpitations, they're anxious, they're depressed, and really they're in menopause.
It
So,
sounds like anxiety. Oh my goodness.
and I think it is, yes, it's very similar. And it doesn't happen to everybody. So I want to just make that point. Only 10% of women have symptoms throughout their life. Most people have symptoms and then they go away. So, and some people have no symptoms. They just stop having their period and they're good. But there's some lifestyle changes that really help menopause. And I hope I'm not skipping ahead, but I do want to point that out. So exercise really helps menopause. Avoidance of sugar really helps menopause. And all the menopausal women that are listening to this know I'm telling the truth. You drink a glass of wine and you're burning up. You're out with your friends, everybody's having wine, everybody's enjoying themselves. You drink your wine and you're like, what is happening to me? It's like an internal fire. So that sugar and sometimes nuts, salt, sugar and salt do the same, have the same effect on you in terms of menopause. So at 55, I'm in full menopause. I went through menopause at age 50. So I just kind of want to share that I understand completely because I'm living it. So when I'm eating clean and exercising and doing well, I'm fine. I have no symptoms. But when I drink or don't exercise or have too much stress also brings on the symptoms. Then I have the symptoms. And so, as I said, with menopause, you can have vaginal dryness as well. So I know just at the you talked about sexual dysfunction. So that's one of the problems. I mean, it's this sandpaper feeling, and it's a real thing. And I've had lots of women who have been to maybe male physicians or other physicians, and they say that they're having really painful intercourse. And some people say, well, is it in your brain, or do you not like your partner? And sometimes it's because you don't like your partner, and sometimes, quite frankly, it's because you have vaginal dryness. And what can we do about that? There's lots of things we can do about that. What I tell my patients simply is lots of people like to lose like a KY jelly and stuff. Really, the oils are much better. Coconut oil, anything you consume, you can use for lubrication. And there's also medications, estrogen and non-estrogen medications that you can use for vaginal atrophy is the medical name, vaginal atrophy.
Okay. So you said if you can consume it, you can use it. So we're talking about olive oil, we're talking about coconut, almond oil, we're talking about sesame seed oil, jojoba oil. Well, we all of those. You can use
Yeah,
all of them.
anything, even olive oil. I mean, you don't want to smell like you're eating something, but yeah, olive oil too.
Okay. So then my next question is, do these oils cause any issues? Because I'm
Vaginitis. You're asking me about vaginitis. Like, do they cause vaginal discharge? Do they cause infections?
yes.
Generally speaking, no. Because if you think about them, I mean, you're still consuming them, right? You're having them with your food, and so no, there should be no issues. I've
Okay.
never had a patient have an infection as a result of it. I mean, could it happen? I don't want to say it can never happen, but my 20 years experience, I have not really had people complain about vaginitis, vaginal issues, vaginal irritation, vaginal discharge as a result of it.
So I'm thinking about the density of the different oils. Does that matter at all? How a sesame oil is very light versus an olive oil that can be thicker? Or
I
it's
think
just
it's
a
personal preference, but to be
preference?
honest, a mineral oil is cheap and it works and it's effective.
Wow.
So
So when
generally, I prescribe mineral oil.
really interesting, because so I'm a former esthetician and we wanted nothing to do with mineral oil, especially on the face. It was a taboo back in that time. So that's interesting that mineral oil might be an option for a lubricant. Thank you for that information. So when it comes to sexual dysfunction, I know that that is not the only issue that women are facing as they're going through this menopause. What are some of the other issues that um, people are not necessarily aware of?
Well, the vaginal dryness obviously is related to menopause, but also decreased desire. As you age, you have a decreased desire, and there's no really good treatment for that. They do have one medication. It's called Addyi. It's basically a sort of an antidepressant, anti-anxiety, unlike the male version of the blue pill.
The
You have
Viagra.
Viagra. You have to take it every day. So that doesn't appeal to a lot of women. You can't just like take it and then you have desire and then you have sex. So it doesn't work as well. So what I really recommend and what I tell my patients is to think about it and plan for it, which um, it sounds crazy. Like I'm supposed to think about sex and then I'm supposed to want it. Yeah. So like on Friday, think about I'm going to have sex with my husband, my partner on Friday, because the reason that men want to have sex is because they're thinking about it all the time.
Yeah, they do. Oh, absolutely. This has been awesome to have. I do want to ask you one more question. What for the hot flashes or for those feelings, is there anything OTC over the counter that women can try, or anything that you personally used during your course to help with the symptoms?
There are over-the-counter medications. I, really always lead with lifestyle changes. So my first recommendation would be lifestyle changes. Secondly, there's like soy products that you can use, and you go to the grocery store, they some estrogens, quote unquote, and then I don't have any names per se, but there are over-the-counter. They call them menopause aids and things like that. Most of them have soy products though. Um, and then there's medication actually. I often prescribe antidepressant, something called Effexor, for patients who have hot flashes. I have them taken in the evening, and it helps a lot. And then, quite frankly, there's estrogen and progesterone, which are hormones. Um, there was a study published about roughly 12 years ago. It was called the Women's Health Initiative. They tested women that were over 55 who had, menopausal symptoms. They gave them something called Primpro, which is Premarin and Provera together, estrogen and progesterone together.
Mhm.
What they found, they tested 10,000 women. What they found is at 5 years, 7 to 10 out of 10,000 of those women had a high incidence of breast cancer, stroke, and heart disease. So estrogen and progesterone got a bad rap because of that. But I will tell you that I have women who are really struggling with their activities of daily living, and they come in and I do prescribe the medication, and they say to me like, I'm just going to take it for a little while, and I'm just going to take it for a couple months. I don't, and then I'm going to stop. And I always tell them, you're not going to stop because you're going to feel great. So it's an option, and I don't think it's something that we necessarily. Sorry.
That's okay. We're living in this technological time, so we have to do what we got to do. So, finish what you were saying?
No, I was just saying that estrogen and progesterone is an option if you're really struggling through your activities of daily living. If you're really anxious, if you're really having a hard time, I prescribe it. I don't think it's something that we should be afraid of, and it got a bad rap because of this Women's Health Initiative study that was
Got
done roughly 12 years ago.
So is that what they mean when they talk about hormone replacement therapy?
Exactly. Estrogen and progesterone, hormone replacement therapy.
Okay. Interesting. So, if anyone has a question that they would like to ask, do you have a work email that you can give to people if they want to talk to you about anything?
I'm going to give you my personal email because it's easy. It's just Karen Johnson 9 at me.com.
It has been such a pleasure to talk with you, and I actually learned something, so I appreciate that very much. And I hope to have you as a guest for another topic on another day. Thank you so, Aurora. I appreciate
Okay, I love it. Thank you.
you. Bye-bye.
Bye.